New data released by the Missouri Coalition Against Domestic and Sexual Violence says for every person shelters are able to house, there are two others that they have to turn away. ABC 17's Dan Messinio has been looking through the numbers and joins us now in studio. And Dan, shelters have the same issue here in mid-Missouri.
They do, Marissa. This graph shows numbers for mid-Missouri. Now, the Missouri Coalition Against Domestic Violence sheltered more than 1,200 people in 2015, but had to turn away about 350. However, the latest numbers also show state funding has helped the coalition expand certain services to thousands of people. The Missouri Coalition Against Domestic and Sexual Violence, or the MCADSV, released numbers showing nearly 36,000 people benefited from services in 2015. But still, just over 22,000 requests went unmet.
Our domestic violence numbers have remained incredibly high, not only in the number of services that they're offering, but also in the number of individuals that they are having to turn away.
The MCADSV compiles domestic violence statistics from shelters across the state. The recent numbers show Missouri shelters house more than 10,000 domestic abuse survivors and had to say no to more than 17,000. When compared to numbers from last year, shelters were able to help more and turn away fewer. And due to $500,000 more in state funding, organizations were able to help thousands of sexual assault survivors.
We know that from our stats, we did provide services, documented services, twice as many as the prior year. It may be for some of our programs that funding allowed them to expand services.
We looked into domestic assault numbers in Missouri and saw a rise in incidents during this time of year. MCADSV administrators say they've heard others notice the increase too, but they haven't seen it.
We don't see much difference because our programs are at capacity year-round. And so we're seeing still level services every month of the year.
MCADSV says more than 90% of people helped by domestic violence programs report an increase in their sense of safety.